What's up, guys? So we're going to be talking about rib injuries today, and I'm going to give you some basic guidelines that I think will be really helpful in a safe return to training. Rib injuries are very common. I'm seeing it more and more frequently. I'm getting a lot more questions on rib injuries. And the difficult thing about rib injuries is they tend to linger and they stick around. They're kind of difficult to treat. I found that they have a high risk of re-injury as well. You may feel like you're starting to feel better and you get back to training and then you tweak your rib or your side. So I'm gonna give you a couple of tips that you can kind of follow. So number one, start with a proper diagnosis and a proper assessment. You want to make sure that whether you have a fracture or a tear in your cartilage or damage to your cartilage, you want to make sure you have the proper diagnosis, because that's going to help your recovery and it's going to help guide what exercise and what progressions you want to work at. So see a doctor or a physical therapist. You may need an x-ray to clear a fracture. So that's number one. So number two, we're looking at pain management, pain control. If it's within the first 48 to 72 hours, I like ice application. You can do 10 to 15 minutes. As needed, I'd say every couple hours is fine. That can help initially control some of the pain, but after that period of time, I like to kind of wean off of the ice unless you really need it, after training or after some exercise. But you should really be mindful that the activities you're doing are not aggravating your symptoms. So that actually leads to number three, and number three is keep your pain down. So whatever you're doing on a visual analog scale or pain scale of 0 to 10, 10 being the worst pain you can think of, 0 being no pain at all, I would say none of your activities or movements should probably increase your pain more than about a 3 to 4. I'd say keep it within a 3. So if you're starting to get back to training or movement or exercise, keep that pain within a 3 or below, preferably no pain at all. Those are good signs that you can move on to the next level of your rehab or more intense training or movements. So number 4, we're looking at regaining mobility, whether it's just gentle movement. I love thoracic spine cars. I'll link the video below. So those are kind of somewhere you can kind of hold and just do your rotational movements all the way around. I like those. I like cat-cow exercise and also some reach-throughs or even a side-lying open book stretch. And I'll leave some links down below to some of those. But those are some good exercises to look at to regain some flexion extension, rotation, and a little bit of side bending as well. You want to regain full range of motion in all of those planes. Your spine doesn't just move in one way. A lot of times you need combined movement like rotation and extension or rotation and flexion. So those are important to adhere to and get those movements fully back. Number 5. So number 5 is going to be begin isometric or strengthening in a plane where you're like in a neutral position. I like planks, forward planks or prone planks, side planks, and then even some pal-off press or maybe some exercise where you're keeping a nice stable core and doing some presses with a resistance band. Those are excellent to do. They're very helpful. They help kind of build some stability in that trunk and in your ribs. So work on those. So number 6 is you're going to start to incorporate some rotational movements. So you may use some resistance bands and do some rotational movements. You may even do some resisted kind of combined movements, doing some arm movements, some wood choppers. Those are great. You're starting to combine multiple movement patterns together, which is going to simulate normal activity. And those are important to do. If you can tolerate those with a little bit of resistance, then you're getting back and you're healing up nicely. So keep up with those, spend the appropriate time on that. Number 7, make sure you have clearance from your physician or your medical provider, whoever you're seeing for your care. But again, start the training back very slow. I am encouraging you because this is where a lot of re-injuries occur. You feel pretty decent doing the basic stuff and you get back into it, somebody puts some pressure on you and then it hurts and you re-aggravate your symptoms, and then you're frustrated and you're doing this song and dance where back and forth, you're getting injured, you're feeling better, you're getting injured, feeling better. So don't elongate the process longer than you have to. Start with solo movements, solo drills, nice slow pace, then increase the intensity or the speed. Incorporate partner drilling or partner positional movements so that way you can use a little bit of weight or resistance of your partner. Then positional drilling, positional rolling even, And the final stage is full training, full rolling. Again, communicate with your partners, let them know what's going on, what you're feeling, how you're feeling, and listen to your body. I mean, that's really it. That's number 8. Listen to your body. Really, really important. Adjust your training. You may, feel like just because you've moved up in the intensity doesn't mean you can't go back down and modify and adjust. You might have ebbs and flows in your training. Some days you're going to feel a little better, more loose. Some days you're not. Just adjust it accordingly. And here's a bonus. A really great thing to work on is diaphragmatic breathing or belly breathing. I'll leave a link down below that I showed as a recovery breathing technique where you're laying down on your back with your legs propped up after training. That's phenomenal because you're helping those muscles, your diaphragm, work properly. You're also helping, you can work into the ribs as well, helping those ribs expand and getting some gentle movement that way, taking nice, big, deep breaths. That's a way you can kind of help the mobility in those ribs as well, get that function back in those ribs. And that's it, guys. I know it's a pretty exhaustive list. There's a lot of things to look at, but those should be helpful. And ribs are tricky. They're very tricky. Just be mindful and be diligent with your assessment of how you're feeling. Don't try to move faster than your body will allow you to, because you're going to end up getting re-aggravations and re-injuries, and then you're going to take this process that could maybe take you 6 to 8 weeks, make it a 12, 14, 16 week process. I've seen it happen, and it really will stunt your training and you'll be frustrated. So try to take out that frustration. Get a good someone that can really guide your treatment. I think that's important. That's very valuable. Someone at least that knows the human body and can help promote the healing process. So that's it, guys. If you have any questions, shoot me a comment down below. I'll talk to you guys next time.